Well, here in Queensland, we haven't had a new case of COVID-19 outside of quarantine since May. Today, we are confirming 2 new cases of COVID-19 here. Both likely acquired the disease interstate. They have a history of interstate travel. That brings our total number of cases to 1,078, 4 now in hospital, 7 of them active. Both of the new cases are 19-year-old women, one from Logan, one from Acacia Ridge. They are both now being cared for at the PA hospital. They both travelled together recently, including returning to Brisbane from Melbourne on the 21st of July via Sydney. They travelled on flights VA863 and VA977. The Queensland Health contact tracers are identifying close contacts from those flights. One of them works at Parklands Christian College, and you will have seen that families were notified of that potential exposure last night. I understand an event that was planned last night was cancelled, and that the school is now closed while a deep clean of the school is undertaken. Close contacts at the school are being identified. Testing capability will be set up at the school and be operational this afternoon. Rapid testing capability will now be deployed right throughout the region. These young women have gone about their business within the communities that they live in, and so there will be a large amount of contact tracing to be done, largely within the Logan and Springfield areas, including shopping malls, restaurants, and a church. Our contact tracers are doing that work right now. There are also a number of close contacts in both of their households that will now be ordered to quarantine. The most important message here is that anyone with any concern on the south side of Brisbane, but particularly in those Logan and Springfield Lakes regions, should go and get tested. We have responded in Queensland to situations like this before. The Cairns Pathology Lab, the North Rockhampton Nursing Home. And because of our responses, we have been able to contain cases like this and suppress any community transmission. And we will do what we did there and everything that we learned from those situations now to respond to these 2 new cases. The whole of our system will be mobilised. The Chief Health Officer will provide more details about other precautions that she is putting in place, including locking down aged care facilities in the Metro South region. We've seen in other states that the most important thing in the period while we see if there is any other community transmission is making sure that nobody in an aged care facility is exposed. This is clearly an evolving situation. We'll do our best to provide you with information as we have it to hand. But today, a lot of people will be interviewed by our public health staff and in some cases by police. And it is absolutely critical that everybody we speak to is fulsome and honest with our staff. The impacts of breaking the COVID rules and the impacts of being dishonest and exposing people to this virus can be massive. We may have to in addition to closing schools and locking down aged care facilities, we may need to close shopping centres and restaurants and churches. That's the kind of impact people can have here. And so it's absolutely critical that every person we contact, every person we speak to, provides us with the information we need and quarantines if they are requested to do so. If there is anyone with any doubt about whether they might have been exposed to this virus, they must go and get tested. Go and get tested today. We will ensure there is extra testing capability that anyone who needs to get tested can and should, for their own sake, for their family's sake, and also for the members of their communities who they could expose to this virus.
Well, it is very disappointing that this has occurred. So 2 young women returned from Melbourne, which we know is an absolute hotspot with a lot of cases, returned from Melbourne on the 21st of July via Sydney and have now tested positive. And as a result of that, a lot of people are going to be inconvenienced. And I do apologise to those people for what is now going to have to occur. But we know if we act really fast now, we can stop this spreading further and cause even more inconvenience to a lot of people. So there are going to be shopping centres, a school, restaurants, they're all going to be closed now for at least 48 hours while we arrange a deep clean of those facilities and contact trace people who attended. Then also I have asked that all of the aged care facilities in the Metro South area be closed to visitors. They have enhanced screening of staff and that staff aren't to work across multiple facilities. We need to act really, really fast. These 2 young women have been out in the community for 8 days whilst unwell. So please, anyone who lives in that Logan, Acacia Ridge, Springfield Lakes areas, if you have any symptoms at all, if you're concerned, please come forward immediately and get tested. There'll be additional fever clinics put in place, but please see your own GP, go to one of the fever clinics that are there and get yourself tested as soon as possible. And if you're unwell, stay at home and isolate yourself. That is the way we can all work together to stop this further spreading. Thank you.
Yes, good morning everyone, and as you've heard from the Deputy Premier and the Chief Health Officer, our primary focus at the moment is to track down anyone that's been exposed to this and make sure that we can identify them. We are using all of our government arrangements, including our disaster management frameworks, to assist health to do that. We will make sure that the priority is to identify and eliminate any further transmission of COVID in that area. I can also say to you that there is an investigation that is going on into the circumstances of these 2 young women coming back from Victoria into Queensland, including the way they got through the border and the fact that they were in the community for 8 days when they should have been quarantined. And our investigation will examine that, and at the end of the day we'll make an appropriate decision around what should happen with that.
Were they less than honest? Did they lie on their declarations about coming from Melbourne?
At this stage, the initial investigations indicate that there are incorrect details on border declaration passes, and we're still trying to examine all of those facts and obtain the border declaration passes. The investigation will look at whether that was deliberate or otherwise.
Incorrect information about where they'd been, their identities, or?
So our concern, of course, is that these people are able to get through the border, ostensibly not looking as if they had been in Victoria, but the investigation indicates they have been in Victoria.
They didn't declare they'd been.
I'm not going to get into what they've done. The investigation will determine that.
And Steve, do we know if they stop in Sydney or in Sydney for a few days as well?
Look, this is very early days, so we're working with the interstate authorities around what has occurred in the other states, indeed, with these people, to track these people's movement and see what they've actually done.
Do we know why they were in Melbourne?
No, I can't answer that at this stage.
And have we got a list that will be provided of us sort of all the places that will be closed and all the places that they've been to?
We know what restaurants they are.
The restaurants and shopping centres.
So we're getting all that detail now, of course, and we'll put that out, and we'll put out a press release later this afternoon listing all the places that these 2 women have been
What
to.
role did the woman at the school, was she a teacher aide, a teacher?
She's a cleaner.
Cleaner? And what about the other?
I don't have the details of the others. So we've only just got that positive result on the second individual before this press conference. So we're getting all that information.
Do you know how many aged care facilities that will impact in that Metro South?
I don't know how many there are in Metro South, but it'll be quite a number. It's just a very precautionary. There is absolutely nothing at this point of time suggesting that either of these 2 individuals have visited any aged care facility, but just in case one of them's come into contact with someone who then goes to an aged care facility, just because we know how vulnerable those people are. So I'm asking them just for the next 48 hours till we get more information, just to limit any risks.
What about their living arrangements?
They've been out and about for 8, 12 days with symptoms. Did they lie about their symptoms presumably in order to enter restaurants and shopping centres?
I don't know what they've said when they've been out and about, but they've been out and about for 8
With
days.
symptoms?
With symptoms.
Can anyone in the community attend the fever clinic at the school and get tested, or is it just for the school community?
No, anyone can attend anywhere, but we'll be putting in place more fever clinics, so I would recommend at this point in time that people only go to the school fever clinic if they go to that school, because they're highest risk, because the individual was a cleaner, cleaning all through that school, so I would prefer that people use that fever clinic if they've been at the
Do
school.
we know anything about their living arrangements? Do they share accommodation, presumably at that age, or are they at home?
They're in 2 households.
How many of their close contacts are now in quarantine and where are they being treated?
At this point in time they're in their home, but I'm organising them to go into hotels.
How would you describe their behaviour?
I'm very, very disappointed. I think it was reckless.
When was it known that this has actually occurred? Like, it was known early yesterday afternoon. Why was this not announced yesterday afternoon?
So we immediately, with the first individual, went to the school and worked with the school, and since then we've been gathering more information overnight, and then this morning we got the second test result of her friend. So we only got that result this morning because she was a close contact.
Was she made to have a test if there was a problem, or did she go and have one?
No, she went and had the test. Yeah.
How many days did it take her to decide to get the test when she arrived?
It took quite a number of days. Yes.
South Australia's closed their border to England for people who live in South Australia if they've been to Victoria. Are you looking at anything?
Well, we already have closed our border to anyone who visits Victoria. You are required when you enter Queensland to go into quarantine. Doesn't matter who you are. Doesn't matter if you're a Queenslander or you're someone from any other state. If you've been in Victoria, you're required to quarantine in a hotel.
Did one of these young ladies attend a church?
Yes, that's correct.
The census does show there are flaws within the border declaration system. How will these be rectified? Will you be looking into ways to change or strengthen?
Well, we need people to tell the truth. That's all I can say, that this is being done to protect yourself as an individual, your family, the community. People must always tell the truth, whether it's filling out a border declaration, whether it's talking to a contact tracing officer. That's absolutely critical.
Look, what about closing the borders now that this has happened? How much does this put that now in the situation where closing the borders soon is now a real possibility because this has occurred?
Well, our border is already closed to Victoria. So if you've been to Victoria for any reason in the previous 14 days, when you cross the border into Queensland, you are required, with very, very few exemptions, to go into quarantine, hotel quarantine.
Given what's happening around Potts Point,
That
you go-
area
Yes.
of Potts Point, is that something that you're looking at that might become a hotspot, given they had declared that a cluster down there?
Absolutely. So every single day I do look with a lot of detail at all of the cases in the rest of the country and see their impact on Queensland.
We need to, how many more cases do you think we might need to see in that area for it to reach that threshold?
Yeah, it's a matter of what sort of cases. It's a matter of whether they know where they've come from. It's a matter of how far they are from other cases. There are so many variables. It's really hard to pick out one factor. It's about all of those factors. And that's the decision making that happens each day.
Steve, I don't know how strong you'd be willing to go on this, but you've really impressed on the whole of the community the need to obviously tell the truth and not lie on the border passes or to provide wholesome information. How are you feeling?
As Jeannette says, this is very disappointing that we have to get to this stage. Can I just tell you that this is a criminal investigation that we're conducting, so I'm constrained around what I'll say about that at this stage. So, and investigations are about ascertaining the truth. So we want to work out what's actually happened here, not only in terms of what any individual may have done, but also how the system has operated and see whether there's things we need to consider. So we'll do that very thoroughly and very quickly. But we've had over 1.1 million people get border declaration passes, and the vast majority of people do the right thing. What this highlights is why it's so important that everyone engages with that and does the right thing. You know, the whole point of coming back from Victoria is because there's so much community transmission down there. You're putting everyone at risk if you don't declare that. And certainly there are systems that are in place to help people get through that. So you get tested and you go through quarantine and then everything's okay.
How do you stop people lying?
I think we've been struggling with that for a long time, Lane. I'd say to everyone is that you need to think about those around you rather than just yourself, because it's not, they just don't know necessarily whether they're sick and whether they have COVID. It's not until they're tested and that's confirmed that it's happened. So people need to think about others, not just themselves. No, as I said, I'm not going to get into the details of that. We're still early days. We're still engaging with Victorian authorities around what we can find out from there. So it's all part of the investigation.
Do you know where they were in Melbourne?
Sorry?
Do you know where they were in Melbourne?
No, I'm not going to get into that.
Dr. Young, would you advise people in that southern part of Brisbane to start wearing masks?
No, we don't have community transmission at this point. What I do advise people to do is get tested. That's the most important thing they can do for themselves and for the rest of the community. If they've got any symptoms at all, or a fever, or even a history of a fever, to immediately come forward and get tested and isolate themselves until they get that test result. If everyone in the southern part of Brisbane absolutely commits to do that today, then we'll all be a lot safer. That is far, far more effective than wearing masks.
Has that cleaner, she was working at school last week as well, how many days she turned up for work?
A number of days.
How many employees are isolating now as a result of that?
I don't have that information, but the whole school is closed.
We've heard her mother perhaps worked in that school as well, is that the case?
I believe so, yes.
And she's being tested.
Yeah. Oh yes, we're testing everyone in her family and the other lady's family.
Do any of the close contacts have symptoms at this stage?
I don't have that full
I
information.
know she was a cleaner as well.
I don't know.
On the closure of aged care facilities, will the government be doing a review of the internal quarantine procedures so we don't have similar outbreaks that we've seen in Victoria?
In aged care,
Aged care facilities for residents.
we've put in place plans for our aged care facilities right from day one. So we have rapid response plans. Just remember, we don't have a case in an aged care facility today. This is all about preventing a case. So we're just taking that very precautionary response that we had right at the start of the pandemic. So right at the start of the pandemic, we put processes in place for aged care facilities so they didn't have visitors, so they checked staff. I'm just making sure that they put all of that back in place until we know what we're doing.
Do you worry there may be others in the community who have applied as well and are out there? What's your message to them if so?
I am always worried about that. I think the vast majority of Queenslanders have done a brilliant response, and that's why we've not had cases. It is very disappointing about these two cases, but I have a lot of confidence that our community will do what is needed today.